My proposed research trial assesses the impact of calcium and vitamin D supplementation on the recurrence rate of colorectal cancer following chemotherapy treatment in patients under the age of 50. At the start of the trial, a food frequency questionnaire was used to assess dairy, fish, and vegetable intake, along with sun exposure, and a baseline blood draw was used to assess calcium and vitamin D levels. Participants were then randomized into a control and intervention group, where the intervention group received calcium and vitamin 3 supplements. The data presented in the tables is not an accurate depiction of the results, as the research was not conducted, but we anticipate seeing something similar to this. The anticipated results of the study is seen in the bar graph to the right, which shows calcium and vitamin D3 levels would be increased and the rate of colorectal cancer recurrence would be decreased.